how do you go about measuring the value of the healthcare you currently have in place, both the value to the employees and the value to yourselves as a business? Lisa?
I think it's quite difficult to measure, actually, because you could measure in terms of how much you've spent on sickness over the past year, for example, or how much the BUPA's cost, or the EAP, and how many people have used it. I mean, there's kind of the usual sort of data that you get from that. But I think it's quite difficult in terms of talking to the board of, if you didn't have this in place, how much it would actually cost. I think it's quite a difficult one.
Bims?
Because we do very limited things, I can only really talk from an occupational specialist view, and that has been invaluable to us in terms of managing, shall we say, complex ER cases, which can be very costly in terms of litigation. It sends a message to the organisation that you're trying to work together, but it's also been used in a positive way to show that actually working together you can get employees back to work, and actually that's the message I would much prefer to have out there than the rod, if I'm honest. And for a charity that believes in sort of values, that's, although you can't necessarily measure it in a cost way, you can measure it in other ways. It says to your staff that you're listening to them and want to work with them.
I'd agree that it's really hard to measure, because I think it's quite hard to separate almost from other things when you're looking at employee engagement. I mean, obviously we get the data from Prue Health, so we know how many people are engaged with the Prue Health scheme, with the Vitality scheme. We do also give everybody the option of annually of whether they want to renew, and most people do, so sort of above 90% choose to renew every year. So we know that people, and the majority of people do take up the healthcare, so we know that the team value it in that way. And we do have very low sickness absence as well.
Well, I'd agree with the people around the table. I think because wellness is essentially a preventative step, it's quite hard to measure something that doesn't hopefully exist. You can take the traditional measures of things like turnover and absence rates, but as we've heard, they can equally be affected by other things. You know, absence rates fall. Is that because presenteeism has risen? I think you really need to have a look at it in the whole, mixing well-being alongside culture and values and staff engagement. Hopefully all of them rise together and not just one individual isolated thing. Engagement comes from many different sources, from believing in the company itself, in the line managers and their skills. I already mentioned that the line manager's skills in dealing with return to work interviews, for example, is key. The employees having a sense of voice and involvement in the business, and the idea that the company is being true to its own values. So if the company sets itself up as being one that's culturally set up to look after its staff, of being very caring, then wellbeing initiatives are core to its essence, I think. And if they don't do what they say they do on the wall, then those values then won't transfer into engagement.
And Kalpa, you said that that some of your healthcare is for the senior executives. On a more general level, how do you engage employees with their own wellness?
I have to admit, it's very ad hoc. So it's when it arises. So I'll hear from either them directly. I think there is a culture where people do feel that it's okay to come and have a conversation with HR or their line managers. I think there is a good culture there. But it's not proactive in asking the question, raising awareness, like some of you have said, you know, to promote this. So yeah, it's not ideal. We need to do something about that.
I think it's hard to identify what aspects of engagement come purely from healthcare and well-being, because I think it's just part of your offering as an employer overall, and I think it's part about doing the right thing for your people.
Lisa?
I mean, we measure staff engagement, but in terms of health and well-being, again, I agree with you that it's quite difficult to measure that when, you know, we get the scores for the staff engagement surveys. But I do think it has improved in terms of we have been promoting more about health and well-being, or we're starting to, and certainly communicating the benefits that they do have, because for some time, I think you were saying that we had these benefits, but they weren't really promoted, they weren't communicated. It was just, you know, on your first day of employment, you know, you've got all these benefits, but they didn't actually know the benefit of those. Mm-hmm. So I think, yeah, it's kind of communication and reminding people as well.
I think the communication side is crucial. We get involved with a lot of flex benefit schemes, through platform providers and consultants, especially to the bigger blue chip companies. And you can have two almost identical companies, say with 7,000 staff each, both have flexible benefit schemes, both through the same provider with the same benefits. The take up on one, and this is voluntary flex bends, the take up on one is abysmal, and the take up on this one is really high. And it's the same pattern, so what's different? And every time it's the communication through to the employees, how those benefits were communicated. You mentioned what do the employees want? One company has asked that, they've put the products into the flex bend scheme because that's what the staff were saying. Then they've said, you asked for these, we've put them in. The other company's done nothing at all. They've put a flex bend scheme in, no take up.
There might also be a bit of a myth that insurers, they don't necessarily want people to make lots of claims because obviously they don't make so much money, but that is a myth. They do want people to use the policies that they provide because they want you to renew that policy. So if there's more engagement, then you're more likely to sort of hang on to that plan. And where we've gone along, often we'll put a PMI plan and a cash plan alongside and they sort of work nicely together. And when that happens, we'll bring along, Bupa or whoever the insurer is, we'll bring along Health Shield or whoever the other cash plan provider is. And that creates excitement in the room. You see employees, their ears prick up because it's very different hearing one of their colleagues saying, oh gosh, it was great, I just had a crown and a claim, I got 250 quid back. That just creates a bit of excitement and it just improves usage. So those engagement sort of meetings are key. Those face-to-face meetings are key.
Jayne, is this something that you're seeing as well? You're really opening that conversation about communications with employees?
Yeah, there was a study done a few years ago at Harvard Business Review that looked at the ingredients that need to be in place for a successful health and wellbeing strategy. The first one is leadership. We've talked about that already today, but one of the other ones is very much about communication and having that communication sensitive to the cultural mix and diversity and needs. I'm a great believer, I've got a marketing background, and I'm a great believer of relevance and receptivity. You've got to make the messages relevant. You're right, people will use some services because they need them. I think sometimes people just don't know what they don't know, and I'm a great believer in communication and partnerships. Some of the best contracts that we are part of is when all the suppliers come around the table and have a very engaging conversation, and they absolutely are all there with one mission, and that's to support the organisation's overarching health and wellbeing strategy. So for me, if you've got a strategy which is aligned to your business strategy, then all your healthcare needs, wants and provisions can fall out the back end of that.